Hi, everyone. Welcome to our latest version of Revenue Cycle Leaders Coffee Chat. This is number 9, which is amazing because we do this every other week, which means that we've been doing this for quite a while now, which is fun. Today, we wanted to take a slightly different direction. We were reviewing the Becker's Hospital Review. They send out a digest with articles of interest, and we read through a group of us, and started discussing it. It's called 3 Health Systems Revenue Cycle Wins from Overhauling Patient Billing by Andrew Cass. And it was an interesting article. It basically went through these 3 major hospital systems and what they have done to effectively transform their own revenue cycle in different ways, and improve their operational efficiency, a little bit through automation, a little bit through change management. And so what Pam and I wanted to do was really run through some highlights that we found in the article, and run through those. So we're going to try and hit 3 different themes, right? So better billing, and where does that start in the revenue cycle? And then why is standardization something that health centers are starting to focus on a little bit more than before? And then the fact that technology it's not really about the software, right? It's about the change management and the transformation that people have to make. So Pam, why don't you kick us off?
Sure. Thanks, Anna. So we're talking about these kind of like 3 areas in rev cycle that Becker's was talking about. Becker's highlighted. And one of the things is that better billing really starts much earlier in the rev cycle. And I thought it was interesting because Becker's mentioned that one of the things they said was improving the patient billing experience. In improving that experience, one thing that stood out is that the billing is really the result of everything that happens before the bill is ever generated. Right. So billing is like, you think like what you're going in, you're having a procedure, they're going to code it and they're going to bill you. But there's so much we know because we work in this space, right? There's so much, everything that we do, everything that we work with our customers to achieve is to get to the billing point. So, I mean, we know how much goes into that, right? So it's kind of interesting that Becker's is calling that out in this article to talk about some of the things that happen. We know that we always talk about this, right? Margins are tight in health systems. Margins are tight. CMS guidelines are constantly changing. Reimbursements are constantly getting less and less and less. How are these health systems looking to improve their cash flow without trying to just say like, hey, work harder, right? So I think that's an interesting thing to think about just as a whole. Billing is really, there's so much that leads up to it to actually get to that invoice. And I mean, I don't know, Anna, what do you see when you talk to our clients and prospects, like where organizations, what they're focusing on today?
Yeah, I mean, I think there is, from my perspective, I sort of see it during the implementation and after. And I get to have really interesting conversations with these revenue cycle leaders about what is their current state with coding and their coders and their auditing process, and also with how does all of that then get transferred over to billing and then to the payers and to the patients, right? And one thing that is constantly discussed is the fact that, like, if they can get the coding done faster, then everything else will flow faster, right? So human coders take 3 to 5 to sometimes 7 days post-procedure to get to the outpatient procedures, right? Because if you think about how many procedures can take place in a day, right? And then how quickly you then, as the coder, need to review them. So that's one angle of like, can the coding just happen faster? Increasing coding accuracy and consistency. So I actually just had a conversation last week about this, right? And this customer and I were talking about the fact that their hope is that consistency of coding, not just the accuracy, but the consistency of each procedure coming through in the same way over and over again, they're hoping will also just increase efficiency, right? It will reduce the burden of auditing, the burden of validation on their auditors and coders, and just let the process flow more smoothly. And then, of course, there's the angle of much earlier, right, in the revenue cycle process. Can you identify mismatches before they become full denials? And how quickly can you process those so as to prevent the denial, and then prevent everything that goes into trying to get a denial reversed and trying to get that money back for the hospital. So a lot of discussion around efficiency within the revenue cycle and how much earlier in the revenue cycle can these efficiencies take place, and how can they operationalize those? And part of it is through technology and through AI and through coding automation. And that's where really we come in and can help with that. What are you hearing around standardization? So is that something you're hearing about?
Yes, for sure. So standardization is, I feel like it's becoming one of the buzzwords, right? Standardization, it's becoming a strategic priority in health systems. And this isn't new, but I think we're hearing it more often. Another point from that article in Becker's that caught my attention was Emory University School of Medicine's effort to consolidate multiple physician enterprises into one professional billing platform.
Yeah, that caught my attention.
Yeah, I mean, we know that we hear like a centralization and a standardization. I feel like they go hand in hand. Being able to have that all happening in one place, or we have health systems with multiple locations or multiple, they're not even just standalone hospitals. They might be ASCs. They could be the physicians' offices because the physicians are now employed by the health system. All of these, like standardizing everything so that everyone's doing the same thing or everyone's singing from the same sheet of music, right? I mean, it makes it's a strategic effort for sure to make sure that everything runs smoothly, that the billing is happening faster in a more efficient way, and that these health systems are capturing what they need to capture within those really tight margins.
Yeah. So one of the paragraphs just shortly after what you just quoted, Pam, that also caught my attention was the standardization also opens the door to further automation with workflows aligned across all three organizations. Grady, the Grady Health System, has been able to deploy robotic process automation and artificial intelligence across key revenue cycle functions, letting staff spend less time on repetitive tasks and more on higher value work that supports patients and providers directly. Like, this is it, right? One thing that I think is really interesting, and I think, Pam, we were having this conversation as it relates to like the sales cycle and what you guys talk to within your prospects conversation, right? Is that there are hospital centers. The hospital centers may have ambulatory surgery centers. The hospital employs doctors. The ASCs employ doctors. Sometimes doctors only provide services through the hospital, but do all of their billing through their physician center. Sometimes it's the other way around, right? Doctors work for the hospital, but they also see patients in other hospital centers. I mean, the amount of, I can only think of the word in Hebrew, but the amount of sort of complexity that can be introduced, but that is already existent in the system as it relates to physicians, outpatient procedures, coding, then the subsequent billing that has to go with it is so vast that this whole centralization, as you said, Pam, right, and standardization around processes and procedure and the billing cycle, I think is really one of the things both that Becker's highlights, but also that we've been seeing and talking about.
Absolutely. And that's exactly why organizations like Emory and others that were mentioned in this Becker's article are they're investing in standardization because it's going to reduce that the unnecessary complexities that are created. by operational efficiencies. All of these things are going to benefit the provider, the staff, the finance teams, and ultimately the patients.
Yeah. Yeah. Okay. So we've covered the billing cycle, or rather, how to increase efficiencies and what this article mentions in terms of the revenue cycle. And we've talked about standardization becoming more of a strategic priority. The third sort of leg in the stool, stand,
Yeah.
something, is that, it's not just the technology. So there's a lot of reliance on technology and automation and AI and streamlining technologies, right? Reducing tech stacks so that there's more of a focus on getting things done with fewer systems. But it's not just about the technology, right?
Right.
It's also about the people.
Right. And it's my favorite part because we talk about this a lot, right? I mean, it's my favorite part because it's not technology that's doing this. It's the transformation of the people using the technology. And you
Right.
can't, and we've always say this too. We don't sell a set it and forget it. Nobody really does if you're going to do it successfully. Like you have to have your people on board. And it's really important that they understand how to use it. It's really important that they understand the impact it's going to have before they even get it. Like those things are really important. Like a really good understanding of how this is going to change things for you, and the ability to get those people on board, just mentally on board, just to say like, hey, this is going to be something amazing. This is going to be a game changer. This is going to help me help, my team, help my health system, help our patients that we're caring for. And that's all part of like getting everyone really engaged, committed to be part of this change. And you really have to have those people on board. So I like talking about that. Technology doesn't really, it doesn't transform the whole health system. It's the people behind it. But Becker's in this article talks about it too. They said large scale transformation is never the result of technology alone. It requires committed leadership, trusted partnerships, and then the talented people that are willing to embrace that change. We're all part of that, and we're all responsible for all parts of that, right? We're responsible to be a committed partner from you and I are, from what we do for a living, but we're also really we're responsible for getting that leadership committed, right? We don't want to, we're not just throwing something over the fence and having them sign on the dotted line. We need them to be committed to make this change with us, and then the trickle down is the people that we work with and you work with most closely, in implementation and then afterwards, just keeping everyone on board and successful. We need to have that team of people that are willing to embrace the change, understand it, and really like be a partner with us.
Yeah. Yeah. No, I couldn't agree more that it all ultimately comes down to the people, right? It's that complexity and standardization, but the standardization can't happen if the people behind the complexity, right, aren't willing to embrace it. So those physicians who see patients in other hospitals need to align with one billing system, and that is the billing system in the hospital where they are employed or where they see most of their patients, or where Milagro is doing the coding for professional coding. But, one of the conversations that we had with the implementation team actually earlier this week, we're in the middle of an implementation with one of our customers, and we were running through a session where we reviewed test data within our test environment, and we reviewed it, and we were looking through each of the fields to see how we would code it. And we got to the end of this one particular case that we were reviewing, and we were like, oh yeah, and then this will be the codes. And the coder from the customer was looking at it and going, oh yeah, I guess our system must have coded that wrong the first time around. And our experienced implementation lead sort of chuckled to himself and was like, this is going to happen a few times before you get used to the fact that, like, yeah, we code we know what we're coding, we know what we're looking for, we're going to do this more consistently. And our accuracy levels are such that you're going to notice that sometimes things that you thought were coded properly and you sort of, brushed over actually need that second look. And that's where the peace of mind comes from with the coding that we do. And that ties back right to the initial conversation at the beginning of this call about like how in revenue cycle, what are the things that you can do within your revenue cycle that make things more efficient,
right,
and more standardized and more consistent. And a big part of that is this automation that allows for across the board consistency on those cases that are your bread and butter, those outpatient cases that the doctors do day in, day out from 7 a.m. to 5 p.m. Can be done in such a way that reduces all that noise in the system. But it all comes back to the people. And the people need to acknowledge that there will be changes in the way they work, right? That these systems may take over and do things faster and better and require your eyes at the end of the process. But you, the person, can then turn to things that are more complicated and spend your time doing things so that management, right? You made the point at the beginning, like management isn't just saying like, suck it up and work harder, but rather you can work on the things that are in fact harder and more complicated and also ultimately probably more fulfilling, right? Because those other
things that are just automated and standardized are kind of taking care of themselves and in a more efficient way. Yeah, I agree. And I think also one of the biggest takeaways from this Becker's article is that I feel is that it's that improving financial performances isn't really about one technology or one department, right? It's about connecting that entire rev cycle. It's a big process, and we know that. It's really getting that end-to-end connectivity and having it be standardized, having it be more efficient, that's really what all of our health systems are leaning into, and they really have to. So it's interesting to be along for this ride, kind of be part of it, and be able to partner with people to help really achieve their goals.
Yeah. All right. I mean, I think we've highlighted the 3 points that we saw in this Becker's article. We will link it at the end of, or in the comments of our video and coffee chat for this week. If anyone has read anything else at Becker's or elsewhere that ties in, that you think reinforces anything that we've discussed, if you yourself are seeing anything around standardization and centralization of processes and procedures within the rev cycle, let us know, leave a comment, do all the things.
Check out the Becker's article.
Yeah. And thanks for joining us on this latest Revenue Cycle Leaders Coffee Chat.
Thanks, everyone.